Concepts for unit exam number 1. Remember, hand washing is the single most important thing that we can do to prevent the spread of infections. I don't want to say we can't wash our hands too much, but we wash our hands before and after contact with a patient, after we remove gloves, before we cook our food. We wash our hands after we cook our food. While we're preparing food, we want to make sure that we're washing our hands. We want to just be thinking about surfaces, keeping those surfaces clean, routinely clean them, especially when and try not to use the same surfaces when you are actually using, like, for example, if you're cutting up food as versus cutting up meats. Prevent infections in the home include washing your hands often, routinely cleaning surfaces. You want to separate, do not cross-contaminate one food with the other. You want to use separate cutting boards for meat and fresh produce. And you want to keep food separate in the refrigerator. Food should be cooked at proper temperatures. Make sure food is cooked thoroughly to prevent infections. What should you do? Wash hands before and after preparing food and before handling animals or their food. Yes, that's what we should do. What should you do? Should we clean counters and cutting boards once a week? No, we should clean those counters and cutting boards at a minimum of daily. Even if we're using, like if we're preparing a meal, we have different dishes and different vegetables, and we have meats. You want to clean those counters and you want to clean them as much as possible. So that is incorrect. You want to clean counters and cutting boards more than once a week. You want to thaw foods in the refrigerator. Do not leave them out on the countertops to unthaw. Even when you're using the microwave, you want to keep those surfaces clean because there's sometimes food will splatter. So you want to make sure that you're keeping those surfaces clean to avoid cross-contamination. What should you do? Use the same cutting boards for meat and fresh produce? No, we should not. We should use separate cutting boards for meat, and then we should have a different cutting board for fresh produce, but we should still clean all surfaces. The school nurse plays several roles. What are some key reminders for a school nurse to use when working with families so that they can be respectful and non-discriminatory? We need to keep in mind, we want to establish rapport, establish that trust. We might have to do some extra research on the different cultures, but we want to be because we do want to be sensitive to factors related to socioeconomic and cultural backgrounds. So, and just keep in mind that people are from different cultures, they have different beliefs, and they may not line up with what yours is. So, you want to be very sensitive to factors that are related to social economic status and to socioeconomics and to cultural backgrounds. The school nurse serves a role as an educator. They will provide, many times they will have lunch and learns for parents and teachers, and you're the person that's providing that education, those little tidbits along the way when they have those programs. When they have the parent-teacher meeting, they usually have that once a month. You will be the person that will be providing education during that time. They will call you in if a teacher is needing to identify resources or just to have a talk session about classroom behavior of some of the students, or just to help identify some different approaches to get that learning so that learning can take place. So some conversations you might have to remind the teacher, well, hey, if a student has had developmental delays, that will impact academic progress most really, really severely. And so just having that conversation and having that teacher to remember that they have to identify additional resources. They might want to bring in the IEP team. They might want to bring in the parent to have a sit down talk session to see what things that they do at home. And if the parent wants to take part in the additional resources that they have. So you as a school nurse plays many roles. One of the roles is having those conversations where you may have to help the teacher understand or just bring to their remembrance. Sometimes they have students that have developmental delays and they have to think outside the box in order to get that same information over to that child. Because at the end of the day, you still want that child to learn. So the academic progress or the lack thereof might not be because the child is intending to not do or excel. It could be because they actually have those developmental delays. And that will most severely impact academic progress. The school nurse might have to remind, because the school nurse is that safe person or that safe place, the school nurse might have to remind the staff if they've heard of things that are going on in the community or have went on in the community. For example, a disaster, a parent or a home has burned. And so you might be the one that will have those conversations that will talk about the hardships or things that the community might be experiencing so that the teachers and the principals can be aware of it so that the counselor can identify different resources and or things that can be done to increase that social relationship and identify those resources for those students and their families. So the school nurse serves as the investigator. Sometimes you may find yourself, you have a student that comes almost the same time every day. You check them out and you're not finding anything that's really wrong with them. Nothing's obvious. So you have to serve as that investigator. So your conversation should be purposeful so that the student can tell you more. You might have to ask, well, what were you doing before? I noticed you've been coming around the same time every day. What's happening before, you come to me? What's going on during the first block of school or if they're on periods? What's going on during first period or what's going on through second block or what's going on through second, what is going on during second period? So you're that investigator. You have to ask those purposeful questions so that they can tell you more information. And sometimes they're just waiting on you to tell them, to ask them, because you are that considered safe. That's that safe zone. School nurses, they make a difference. I like this little visual here, but they serve many, many roles. Some common first aid for school nurses. You might have to provide CPR. You clean minor cuts, scrapes, and scratches. You have to apply bandages. You might have to give ice. You might have to do some eye washing, administer or manage a diabetic student, administer medications of all kind. You might have to do dressing changes. You might have to do what they call straight casts or in and out casts. You might have to do tube feedings, removing debris from the eyes. You might have to apply warm compresses or cold compresses. Now, there's a time when you use either. For example, you want to apply a warm compress to an affected eye if there is itching or burning to that eye. You want to apply a warm compress. Scoliosis screening. You might, as a school nurse, take part in these. You may arrange for an outside resource person to come in to actually do these. You might assist the physical education teacher to do the scoliosis check. But scoliosis check and what is scoliosis and what happens during a scoliosis screening? So that is where you have the child to bend forward and you're observing whether or not there's a sideways curvature to the spine. The cause of scoliosis is unknown. And there is also functional scoliosis. Now, it is usually caused by poor posture. So you want to encourage the student to just watch their posture when they're sitting and when they're standing. You know how parents used to tell you, stand up straight, sit up straight. So that functional scoliosis usually comes from poor posture, and it is not considered a spinal disease. And you just wanted to remind that student or that child to stand up straight or to sit up straight. Because many times we get relaxed and we find ourselves to be slumping. But for the scoliosis check, you will have a student to bend forward at the waist and observe the back for asymmetry. We talked about functional scoliosis. Levels of prevention. We will provide interventions. That's part of providing that individualized care. And those interventions, they are on levels. We have a primary level of intervention. We have secondary level of intervention. We have tertiary level of intervention. Primary prevention addresses the use of interventions before the disease actually occurs. You want to prevent the problem, prevent the deficit, prevent the disease process, or prevent the injury altogether, prevent it from occurring at all. So ways that you can do that is that you can provide education, you can hold seminars, you can do radio announcements. You can place information on a handout or a pamphlet. All of that is primary prevention. You're just providing that education in different formats. Secondary prevention is aimed at detecting the disease early through screening programs. So you're that detective. Whatever intervention that you're doing, you're detecting or trying to determine if there is a disease process, if there's an injury, or if there's a deficit there. Secondary prevention activities involve screening activities that allow for early recognition of problems so that prompt interventions can limit a disability. Tertiary prevention, there is a disease process, there is a deficit or injury, it already exists. And we're just trying to prevent, maintain, or trying to heal. For example, if you have a broken bone, you're trying to heal that bone. So that cast is put on so that bone can heal back together. Which level? Counseling about a non-pharmacologic management of back pain. Which level of prevention is this? We're having a conversation. We're providing, we may be identifying resources. We might be identifying some techniques, for example, posture, different postures, different exercises a person can do, but doesn't have anything to do with medication, but the person has back pain. So which level of prevention is this if we are providing that counseling? Correct. It is tertiary because we already have something that exists. And then the existing was this person already had back pain. So we're trying to prevent it from getting worse. Which level of prevention? Screening for hepatitis A or educating on the signs and symptoms of tuberculosis to report, or both are examples of what? So we got screening for hepatitis A, and we are educating on the signs and symptoms of tuberculosis to report. What are both examples of? Remember, for secondary, we are the little detectives, we're screening, we're trying to identify. So these are things and measures that we would do to identify, to see if there's a disease process, to see if there's an injury there, to see if there's a deficit there. And another example is if a person has a screening mammogram. So they're doing a mammogram, but they're screening, just trying to detect to see if there's a disease process, if it's already there, which is different from a regular mammogram if someone is having a mammogram and a nodule or breast cancer has already been identified. Educating about minimizing pesticide exposure. You're the guest speaker at the Lunch and Learn, and you're handing out a pamphlet, or you're up speaking, but your pamphlet is about decreasing pesticide exposure, or your lecture that day is about decreasing pesticide exposure. Which level of prevention is that? It is primary prevention. Remember, primary prevention is intervening before health effects occur. Screening caregivers about how they are doing and suggesting coping strategies. Which level of prevention? Screening caregivers about how they're doing and suggesting coping strategies. That is secondary. We're those detectives. We're screening to identify if there is something there, whether or not it's a disease process, a deficit, or injury. The respiratory system is where the gas exchange takes place, oxygen and carbon between oxygen and carbon dioxide. We do need the lungs, the alveoli, the diaphragm, all of those things for the respiratory, for that gas exchange to actually take place. The respiratory system is a network of organs and tissues that help you breathe. It includes your airways, your lungs, and your blood vessels. So when a person has asthma, the airway is constricted or narrowed. Therefore, they have difficulty moving air. There's difficulty with that gas exchange. So in order to be proactive to prevent asthma attacks, a person might need to keep a journal to identify the triggers, the things that trigger or starts those asthma attacks. They want to identify triggers and so that they can control those symptoms. Because if they know that ragweed or being around cats or dogs or that pet dander, those different things that they have identified as triggers causes those asthma attacks, guess what? Those are the things that they need to stay away from. So they want to keep a journal, and each time they identify something that triggers those asthma attacks, they need to jot it down and keep a record of it. You want to cover mattresses with allergen barriers. The child or person might want to use a spacer or inhaler to improve medication delivery. That's just a device that's added to the inhaler itself, and it increases the amount of medication that is used. So it makes more of the medication actually gets deeper down into the lungs. It's a space, and I have a picture here. Okay, this is just a spacer. Right here is the inhaler, and then this is the spacer itself. So you connect the inhaler to the spacer, and it does help that medication it improves the medication delivery. So a child that has carpet in their room, the parent might want to remove that carpet. Drapes and upholstery, anything that can collect dust, those things should be eliminated from that child's environment. Smoking is proven to be harmful to the children, whether or not it's an e-cigarette, electronic cigarette, or the regular cigarettes. E-cigarettes have found to be just as harmful as traditional cigarettes. Children with respiratory disorders such as asthma have a greater risk of complications from secondhand smoke. You want to create those smoke-free environments. If someone has to smoke, they need to smoke outside and ensure that that smoke is away from that child. Obesity is the greatest health risk to children and requires a community health nurse to provide teaching about prevention and management. They started this new initiative like Get Up and Move, because especially during the pandemic, we had no places to go. And so we had a lot of sit time. We were not up and moving. And so the big initiative came to Get Up and Move. So we had to get creative and identify ways that we could, as a family, take part in the activities, go on evening walks, wash the car. A lot of people got pets, but those things help people to be more active. We want to encourage a diet that follows the food pyramid, avoiding sugary snacks. That includes 100% fruit juices. We would think the 100% of fruit juices is a good thing, but it has empty calories. I actually copied this from the Los Angeles Times. It says nutritionally, fruit juice is a sound choice. Most juices contain nutrients such as vitamin C, potassium, folate, and some are fortified with calcium and vitamin D. Fruit juice has a dark side. Ounce for ounce, many juices, even those that are 100% fruit juice with no added sugar, have more calories and sugar than soda. So that 100% fruit juices have those empty calories. So those are not encouraged. So you would ask the parent to select something else. Encourage parents not to use food as a reward. They want to pay attention to the hunger cues. And it may take a child 10 to maybe 15 times of tasting a food before they actually start to actually like it. So be patient. Firearm and gun safety. We want to have those conversations with the parents and the children because many times the cartoons and then the video games that they play, the characters get up and walk away after a gun has been used or they have been shot. But we want to convey that in real life, people are hurt or they even die if they're shot. If families have guns, you want to encourage them to have to store the guns, to have proper storage. You want to ask them where are the guns stored. You want to look and see if you're doing a home inspection. You want to ask where are those guns stored. Because and the reason you want to do that is because you can identify some potential hazards. You want to encourage them to adhere to gun safety. If they're introducing their children to hunt, they might want to go to the range. They might want to take some gun safety classes. Social determinants of health. As we take care of our patients in the community, we want to consider where cultures, we want to consider where people are born, where they live, social norms, where they learn at, where they work, where they play, where they worship. We want to even consider the age because all of these things, social determinants of health, they affect the functioning and the quality of life. It affects outcomes and risk.